Hello there everyone. In today's video, I'll talk about Tinea Capitis, also known as scalp ringworm, which is a common fungal infection of the scalp involving both the skin and hair and often presents with pruritic, or itchy skin with scaling areas of hair loss. Tinea Capitis are caused by fungi or dermatophyte, which include Trichophyton tonsurans, Microsporum canis, and Microsporum audouinii. Trichophyton tonsurans is the most common cause in the USA. The infection results from contact with infected persons or animals. How common is Tinea Capitis? It most commonly affects children living in hot, humid areas such as Central America, Southeast Asia, and Africa. Most frequently, school-aged children between the ages of 3 and 14 are affected by Tinea Capitis. However, Tinea Capitis can also affect adults. It is particularly prevalent in patients with compromised immune systems. It is contagious and epidemic and occurs worldwide. Males and females are equally affected. People living in close quarters with others, and those sharing objects and materials such as hats, hairbrushes, and sports equipment are at risk. Excessive sweating and not bathing or washing your child frequently is also a risk factor. Now let's look at the signs and symptoms of Tinea Capitis. Inflammation is often low-grade and persistent. The lesions are not annular or sharply marginated, so the disease mimics seborrheic dermatitis. Tinea Capitis can present as a seborrheic-like dermatitis with little to no swelling. Patchy alopecia with broken hair shafts leaving behind black stumps, or black dot ringworm. It can lead to a serious infection with scarring, lymphadenopathy, and indurated, bog-like plaques known as curion, that is coated in pustules and crusting. Flaking scalp that resembles dandruff can occur, and severe itchiness with dry, scaly rashes. How is Tinea Capitis diagnosed? Tinea Capitis is usually suspected clinically but should be confirmed on microscopy and culture. Initially, a physical examination will be done. Your child's hair, skin, and scalp will be examined. It's possible to identify ringworm simply by looking at it. Your child's healthcare provider may also take a small skin scraping to be examined under a microscope or sent to a laboratory for a fungal culture. To confirm a Tinea Capitis diagnosis, the following tests will be ordered. Wood lamp. A wood light is a special type of ultraviolet light. Your child's healthcare provider will shine a wood light onto your child's scalp. Wood lamp examination is diagnostic when hair fluorescence is seen. Identifying affected hairs in this way may help with obtaining an appropriate specimen for culture. Microscopy. A healthcare provider will gently scrape some of the skin from the infected area of your child's scalp. Scrapings from the lesion are placed in a drop of potassium hydroxide and examined under a microscope for the presence of fungal hyphae. This method is cheap, easy to perform, and has high sensitivity. Culture. Fungal culture allows identification of the causative agent, and hence the possible source of infection. A culture is more accurate and specific than a potassium hydroxide stain, but it can take several weeks to get the results. The treatment of Tinea Capitis requires systemic antifungal medication, as topical antifungal products are ineffective for treatment of Tinea Capitis. The preferred treatment for children is micro-sized Trichophyton, that is, Griflevin pills or suspension, 10 mg per kilogram daily for 6 to 8 weeks. The recommended dosage for children with Trichophyton infection is micro-sized Trichophyton suspension, 10 to 20 mg per kilogram per day, or ultra-micro-sized Trichophyton, 5 to 10 mg per kilogram per day, administered with meals or milk for at least 4 weeks or until all symptoms of infection have subsided. Additionally, using shampoo containing 2% selenium sulfide twice weekly helps in lowering viable fungus spore counts. In the event Trichophyton is ineffective, oral ketoconazole is the alternative medication. Until Tinea Capitis is cured, an imidazole or cyclopirox cream should be applied to the scalp to prevent spread, especially to other children. What are the possible complications of Tinea Capitis? The inflammatory Tinea Capitis can cause curion, which are painful, pus-filled patches that sometimes ooze. Scarring and permanent hair loss may result. With inflammatory Tinea Capitis, a secondary rash could develop, especially after starting antifungal therapy. Secondary bacterial infection is another complication that could develop. Erythema nodosum could also occur. And alopecia, particularly scarring alopecia, which causes persistent bald patches, can cause psychosocial distress for the patient. Tinea Capitis infections can be itchy and uncomfortable for your child. Your child should finish the course of treatment. A fungal infection can take at least 6 weeks to go away. Get in touch with your child's doctor if the infection doesn't go away. And that's all for this video. If this video has been helpful, give us a like, share it, and subscribe to our channel. Thank you for watching.